What are the primary modes of transmission for infectious diseases, and how can healthcare professionals implement strategies to interrupt these transmission pathways? Answer: infectious diseases can be transmitted through several primary modes, including direct contact. Transmission occurs when an infected person comes into direct contact with a susceptible person, such as through skin contact or bodily fluids. Indirect contact. Pathogens can be transmitted via contaminated surfaces or objects. Fomites. Droplet transmission. Respiratory droplets expelled during coughing or sneezing can infect others within close proximity, generally within 6 feet. Airborne transmission. Some pathogens can remain suspended in the air for long periods and be inhaled, as seen with diseases like tuberculosis. Vector-borne transmission. Certain diseases are transmitted by vectors such as mosquitoes or ticks, which carry pathogens from one host to another. To interrupt these pathways, healthcare professionals should implement strict hand hygiene protocols, use personal protective equipment (PPE) in appropriate settings, conduct regular cleaning and disinfection of surfaces, promote vaccination to protect against airborne and droplet-transmitted diseases. Discuss the mechanism of action of different antibiotic classes and how this knowledge informs the selection of appropriate treatment for bacterial infections. Answer: antibiotics are classified based on their mechanism of action, which plays a critical role in treating bacterial infections. Key classes include beta-lactam G. Penicillins, cephalosporins. These antibiotics inhibit bacterial cell wall synthesis, leading to cell lysis. Macrolides E. G. Azithromycin. They work by inhibiting protein synthesis at the 50s ribosomal subunit, preventing bacterial growth. Aminoglycosides E. G. Gentamicin. These antibiotics disrupt protein synthesis by binding to the 30s ribosomal subunit, which can lead to misreading of mRNA. Tetracyclines. Similar to aminoglycosides, they inhibit protein synthesis but bind to the 30s ribosomal subunit, effective against a wide range of bacteria. Fluoroquinolones E. G. Ciprofloxacin. These agents inhibit DNA gyrase and topoisomerase IV, crucial enzymes for bacterial DNA replication. Understanding these mechanisms allows healthcare providers to select the appropriate antibiotic based on the type of bacteria, site of infection, and known resistance patterns. For instance, if a gram-positive coccale infection is suspected, a beta-lactam or macrolide may be indicated. Mrs. Smith has been trying to conceive for over a year without success. After thorough evaluation, she is diagnosed with polycystic ovary syndrome (PCOS). Discuss the management strategies that should be implemented for her condition. Answer: management of infertility in patients with PCOS should be comprehensive and tailored to individual needs. Strategies may include weight management. Since obesity can exacerbate insulin resistance and hormonal imbalances in PCOS, achieving a healthy weight through diet and exercise can improve ovulation rates. Ovulation induction. Medications such as clomiphene citrate are commonly used to stimulate ovulation. If clomiphene is ineffective, other options like letrozole or gonadotropins may be considered. Insulin sensitizers. Metformin is often prescribed to improve insulin sensitivity and may help restore normal menstrual cycles and promote ovulation. Lifestyle modifications. Encouraging regular physical activity and a balanced diet rich in whole foods can help manage symptoms. Advanced reproductive technologies. If other methods fail, assisted reproductive technologies, such as in vitro fertilization, may be considered. Continuous monitoring through hormonal assessments and ultrasound evaluations is critical to tailor interventions and track the response to treatment effectively. Analyze how neurobiological factors contribute to the development of major depressive disorder (MDD) and discuss potential implications for treatment. Answer: the development of major depressive disorder (MDD) is multifaceted, with neurobiological factors playing a significant role. Key contributions include neurotransmitter imbalances. Dysregulation of serotonin, norepinephrine, and dopamine pathways is commonly observed in MDD. This imbalance can affect mood regulation, reward processing, and overall emotional well-being. Neuroendocrine factors. The hypothalamic pituitary (HPA) axis may be overactive in individuals with MDD, leading to elevated cortisol levels, which can negatively impact mood and cognitive function. Genetic vulnerabilities. Family history of depression increases the risk, suggesting a heritable component. Genetic polymorphisms, such as those affecting serotonin transport, may influence susceptibility. Neuroinflammation. Recent studies have indicated that inflammation in the central nervous system could contribute to the pathophysiology of MDD, linking immune responses with mood disorders. Implications for treatment include Pharmacotherapy. Antidepressants that target neurotransmitter systems, such as selective serotonin reuptake inhibitors (SRIs), are commonly prescribed. Psychotherapy. Cognitive behavioral therapy (CBT) addresses cognitive distortions and behaviors associated with depression. Lifestyle interventions. Regular exercise has been shown to have antidepressant effects, potentially due to its influence on neurotransmitter systems and neuroinflammation. Understanding these neurobiological underpinnings can help clinicians develop more effective, individualized treatment plans for patients suffering from MDD. Explain the various mechanisms of antibiotic resistance exhibited by bacteria and discuss the public health implications of increasing resistance rates. Answer: bacterial antibiotic resistance is a growing public health concern, and several mechanisms contribute to this phenomenon. Enzymatic degradation. Some bacteria produce enzymes that can break down antibiotics, such as beta-lactamases that inactivate beta-lactam antibiotics. Alteration of target sites. Bacteria may modify the target site of antibiotics, e.g. ribosomes or cell wall precursors, preventing the antibiotic from binding effectively. Efflux pumps. Many bacteria possess efflux pumps that can actively transport antibiotics out of the cell, reducing intracellular concentrations and thus effectiveness. Porant channel alterations. Changes in the permeability of the bacterial membrane can prevent antibiotics from entering the cell, as seen in some gram-negative bacteria. Biofilm formation. Bacteria and biofilms are more resistant to antibiotics due to the protective extracellular matrix and reduced penetration of drugs. The implications for public health include increased morbidity and mortality. Infections caused by resistant organisms can lead to prolonged hospital stays and increased risk of complications. Healthcare costs. Treating resistant infections is often more expensive due to the need for advanced therapies, longer hospitalizations, and additional supportive care. Need for surveillance. Enhanced surveillance systems are essential to monitor resistance patterns and inform treatment guidelines. Education and stewardship. Promoting appropriate use of antibiotics among healthcare providers and patients can help mitigate the emergence of resistance. Describe the role of imaging studies in the diagnosis and management of infectious diseases, highlighting specific conditions where imaging is crucial. Answer: imaging studies play a vital role in the diagnosis and management of infectious diseases. Key uses include detection of abscesses. CT scans are crucial in identifying abscesses, such as those caused by bacterial infections. They provide detailed images that guide drainage procedures. Pulmonary infections. Chest X-rays and CT scans are essential in diagnosing pneumonia, revealing patterns indicative of infectious processes such as infiltrates or effusions. Bone infections. Osteomyelitis. MRI is the preferred modality for detecting osteomyelitis, as it can visualize changes in bone marrow and soft tissue that are not apparent on X-rays. Tuberculosis evaluation. CT imaging can help assess the extent of pulmonary tuberculosis and detect complications such as pleural effusion. Ultrasound in infectious processes. Ultrasound is often utilized for guiding procedures and evaluating soft tissue infections, particularly in pediatric populations where radiation exposure should be minimized. Imaging assists in confirming diagnoses, assessing the severity of infections, and monitoring the effectiveness of treatment, thereby playing a crucial role in patient management. Discuss the hormonal regulation of the menstrual cycle, including the roles of key hormones and their interactions at different phases. Answer: the menstrual cycle is a complex interplay of hormones that regulates ovulation and menstruation. The key hormones involved include follicle-stimulating hormone, FSH, secreted by the anterior pituitary. FSH promotes the growth and maturation of ovarian follicles during the follicular phase. Luteinizing hormone, LH, also produced by the anterior pituitary. Estrogen LH triggers ovulation, leading to the release of the mature oocyte. Estrogen, primarily produced by developing follicles. Estrogen levels rise during the follicular phase, leading to endometrial proliferation in preparation for potential implantation. Progesterone, secreted by the corpus luteum post-ovulation. Progesterone stabilizes the endometrium and prepares it for implantation. If pregnancy does not occur, progesterone levels fall, leading to menstruation. The menstrual cycle can be divided into phases. Follicular phase. FSH stimulates follicular development and estrogen secretion. The increase in estrogen eventually leads to the LH surge. Ovulation. The LH surge triggers ovulation, releasing the oocyte from the follicle. Luteal phase. The corpus luteum forms and secretes progesterone and estrogen, maintaining the endometrium. If no fertilization occurs, hormone levels drop, resulting in menstruation. Understanding this hormonal regulation is crucial for diagnosing and managing reproductive health disorders, such as irregular cycles and infertility. Evaluate the epidemiology and treatment considerations for common sexually transmitted infections, focusing on chlamydia trachomatis and Neisseria gonorrhoeae. Answer: chlamydia trachomatis and Neisseria gonorrhoeae are among the most prevalent STIs with significant public health implications. Epidemiology: chlamydia. It is the most reported STI in the United States, particularly affecting young women aged 15-24. Risk factors include multiple sexual partners and lack of consistent condom use. Gonorrhea. Rates have been rising, particularly among men who have sex with men (MSM) and among young adults. Neisseria gonorrhoeae has shown increasing resistance to antibiotics, complicating treatment. Clinical presentation: chlamydia, often asymptomatic. When symptoms occur, they may include dysuria and pelvic pain. Gonorrhea. Symptoms may include purulent discharge and dysuria, but many cases are also asymptomatic. Diagnosis: nucleic acid amplification tests (NOTs) are the gold standard for diagnosing both infections. Treatment: chlamydia. The recommended treatment is azithromycin 1 gram orally in a single dose or doxycycline 100 mg twice daily for 7 days. Gonorrhea. Treatment often includes a dual therapy approach, such as ceftriaxone 250 mg IM plus azithromycin 1 gram orally to address potential co-infection with chlamydia. Public health implications: routine screening in sexually active populations, particularly young women, is essential for early detection and treatment. Education on safe sex practices and the importance of partner notification and treatment is crucial in controlling the spread of these infections. Analyze the infection control measures that should be implemented in healthcare settings to prevent the transmission of infectious agents, focusing on the role of hand hygiene. Answer: infection control measures are vital in healthcare settings to prevent the transmission of infectious agents. Key strategies include hand hygiene. The cornerstone of infection prevention, hand hygiene significantly reduces the transmission of pathogens. It includes hand washing with soap and water, especially important when hands are visibly soiled or before eating. Alcohol-based hand sanitizers, effective in most situations and preferred when hands are not visibly dirty. Personal protective equipment (PPE). Appropriate use of PPE, gloves, gowns, masks, face shields protects healthcare workers and patients from exposure to infectious agents. Environmental cleaning, regular cleaning and disinfection of surfaces and equipment in patient care areas reduce the risk of cross-contamination. Isolation precautions. Implementing standard and transmission-based precautions based on the mode of transmission, contact, droplet, airborne, helps contain infections. Vaccination. Ensuring that healthcare workers are vaccinated against preventable infections, e.g. influenza, hepatitis B, is crucial for protecting staff and patients. Education and training. Ongoing training for healthcare workers on infection control practices, recognizing outbreaks, and the importance of adherence to protocols can significantly reduce transmission risks. By systematically implementing these infection control measures, healthcare facilities can create a safer environment for both patients and healthcare personnel. Discuss the significance of Pap smears and HPV screening in the prevention of cervical cancer, including guidelines for screening and management of abnormal results. Answer: Pap smears and HPV screening are crucial in cervical cancer prevention through early detection of precancerous lesions and HPV infection. Significance: Pap smears detect cervical cell changes that may lead to cancer, allowing for timely intervention. HPV screening identifies the presence of high-risk HPV types, which are strongly associated with cervical cancer development. Guidelines for screening. Starting age. Screening should begin at age 21, regardless of sexual history. Frequency. Women aged 21-29 should have Pap smears every 3 years. For women aged 30-65, options include Pap smear alone every 3 years, HPV testing alone every 5 years, Pap plus HPV testing every 5 years. Management of abnormal results. ASC/US atypical squamous cells of undetermined significance. If HPV positive, follow up with colposcopy. If negative, return to routine screening. LSIL, low-grade squamous intraepithelial lesion, colposcopy is recommended. HSIL, high-grade squamous intraepithelial lesion, immediate colposcopy and possible biopsy are indicated. Public health implications. Routine screening and HPV vaccination can significantly reduce cervical cancer incidence. Educating women about the importance of screening and vaccination is critical to improving outcomes. A 67-year-old male patient with a history of coronary artery disease presents with worsening shortness of breath and edema. His ejection fraction, F, is measured at 35%. What pharmacological management strategies should be considered in the treatment of his systolic heart failure, and how do these medications address the underlying pathophysiology? Answer: in the management of systolic heart failure with reduced ejection fraction, HFrEF, several key pharmacological agents should be considered. AC inhibitors, e.g. lisinopril. These reduce afterload and preload, improve cardiac output, and prevent the progression of heart failure by inhibiting the renin-angiotensin-aldosterone system ROS. This is crucial in managing the excess fluid and systemic vascular resistance commonly seen in HFrEF. Beta blockers, e.g. carvedilol. These help to reduce heart rate and myocardial oxygen demand, provide neurohormonal modulation by decreasing circulating catecholamines, and improve survival. Diuretics, e.g. furosemide. These are essential for symptomatic relief of fluid overload by promoting renal excretion of sodium and water, thereby reducing preload and congestion. Aldosterone antagonists, e.g. spironolactone. These are beneficial for patients with moderate to severe heart failure to further inhibit the RAAS, thus preventing cardiac remodeling and improving survival. A 32-year-old woman experiences her first generalized tonic-clonic seizure. She has no significant past medical history and is not taking any medications. What are the initial management steps for her condition, and what considerations should be taken for long-term management based on the classification of her seizure? Answer: initial management of a first seizure episode should include safety measures. Ensure the patient is safe and comfortable, prevent injury, and provide reassurance. Postictal care. Monitor vital signs and provide supportive care until the patient recovers. Neurological assessment. Conduct a thorough history and neurological examination, including potential triggers and family history of seizures. For long-term management, if the seizure is classified as generalized tonic-clonic, the patient would typically require antiepileptic drug therapy. First-line medications include levetiracetam or lamotrigine, which are effective for generalized seizures with a favorable side effect profile. Patient education. Discuss potential lifestyle modifications and seizure precautions. Clinical guidelines reference. The National Institute for Health and Care Excellence (NICE) guidelines recommend considering AED treatment after first seizure if there is a high risk of recurrence. A 45-year-old male presents with chronic heartburn and regurgitation. He has been self-treating with over-the-counter antacids but reports no relief. What complications of gastroesophageal reflux disease (GERD) should be considered in this case, and what diagnostic approach is appropriate? Answer: chronic gastroesophageal reflux disease (GERD) can lead to several complications, including esophagitis, inflammation of the esophagus due to acid exposure, strictures, narrowing of the esophagus from scarring, leading to swallowing difficulties, Barrett's esophagus, a precancerous condition where the normal squamous epithelium of the esophagus is replaced with columnar epithelium due to chronic irritation, significantly increasing the risk of esophageal adenocarcinoma. The appropriate diagnostic approach includes upper endoscopy aimed to visualize the esophagus, assess for esophagitis, strictures, or Barrett's esophagus, and obtain biopsies if necessary. Esophageal pH monitoring to quantify acid exposure and correlate symptoms with reflux episodes. Clinical guidelines reference. The American Gastroenterological Association (AGA) recommends endoscopy for patients with alarming symptoms, dysphagia, weight loss, or those with long-standing GERD symptoms to evaluate for complications. A 60-year-old female patient with osteoarthritis in her knees reports persistent pain despite taking over-the-counter NSAIDs. What alternative treatment options could be explored for her condition, and how do these interventions address the underlying pathophysiology of osteoarthritis? Answer: in managing osteoarthritis, OA, particularly when NSAIDs are insufficient, several alternative treatment options can be explored. Physical therapy. Tailored exercises to strengthen muscles around the joint, improve flexibility, and decrease pain. Corticosteroid injections. These provide anti-inflammatory effects directly within the joint, offering temporary relief from severe pain. Hyaluronic acid injections. This is a viscosupplementation therapy that may improve lubrication in the joint and alleviate pain. Weight management. Reducing body weight can significantly decrease the load on weight-bearing joints, alleviating symptoms and slowing progression. Clinical guidelines reference. The Osteoarthritis Research Society International (ORSI) guidelines emphasize a multidisciplinary approach including pharmacological and non-pharmacological treatments tailored to individual patient needs. Mr. Thompson, a 70-year-old male with a long history of smoking, presents to the emergency department with dyspnea and wheezing. His pulmonary function tests indicate a reduced FeV ratio. What immediate interventions should be initiated and what long-term management strategies should be considered for Mr. Thompson's COPD? Answer: for Mr. Thompson, the immediate interventions in the emergency department should include bronchodilator therapy, administer short-acting beta agonist, SABA like albuterol to relieve acute bronchospasm and improve airflow, corticosteroids, consider systemic corticosteroids, e.g. prednisone if there is an acute exacerbation as they can reduce inflammation in the airways, oxygen therapy. If his oxygen saturation is low, SPO 88%, supplemental oxygen should be provided, ensuring to monitor for co-retention. For long-term management strategies, the following should be considered. Smoking cessation, the most critical intervention to slow disease progression, long-acting bronchodilators, LOBAs or LOMAs, for regular use to maintain bronchodilation. Pulmonary rehabilitation, a structured program to improve exercise capacity and quality of life. Vaccinations, annual influenza vaccination and pneumococcal vaccination to prevent respiratory infections. 52-year-old female with a history of obesity and hypertension is diagnosed with type 2 diabetes mellitus (TDM). What are the pharmacological options for her management, considering her comorbidities, and how do these medications target the pathophysiology of TDM? Answer: the pharmacological management of type 2 diabetes mellitus should include metformin. First-line therapy, it enhances insulin sensitivity and decreases hepatic glucose production, particularly effective in overweight patients. GLP-1 receptor agonists, e.g. low-glutide. These promote insulin secretion in response to meals, slow gastric emptying, and promote satiety, aiding in weight loss. SGLT2 inhibitors, e.g. canagliflozin. These help in renal glucose excretion, also offering cardiovascular and renal protection, particularly beneficial for patients with hypertension and obesity. Clinical guidelines reference. The American Diabetes Association (ADA) recommends considering patient-centered approaches in TDM management, emphasizing lifestyle modifications and selecting medications based on individual comorbidities. A 40-year-old woman presents with recurrent headaches that have progressively worsened over the last few months. During the neurological examination, she exhibits a positive straight leg raise test and decreased sensation in the left leg dermatome. What underlying conditions should be suspected and what diagnostic imaging should be pursued? Answer: the clinical presentation suggests the possibility of a herniated lumbar disc, particularly affecting the level, which could be causing nerve root compression leading to radicular symptoms. Given the positive straight leg raise test and sensory deficits, the following should be pursued. MRI of the lumbar spine. This is the gold standard for diagnosing lumbar disc herniation and assessing nerve root involvement. Neurological consultation for further evaluation and potential surgical management if conservative treatment fails. Clinical guidelines reference. The American Academy of Neurology on guidelines suggest MRI for patients with radicular pain who do not respond to conservative management or exhibit significant neurological deficits. 55-year-old male with a history of myocardial infarction presents with palpitations and dizziness. The EKG reveals atrial fibrillation (AF). What are the acute management strategies for this patient and how do these strategies mitigate the risks associated with AF? Answer: the acute management of atrial fibrillation involves rate control, administer beta blockers, e.g. metoprolol, or calcium channel blockers, e.g. diltiazem, to control ventricular rate and improve symptoms, anticoagulation. Assess the CHA2DS2-VASc score to determine the need for anticoagulation to prevent thromboembolic complications, particularly stroke. Initiating anticoagulation, e.g. warfarin or direct oral anticoagulants like apixaban, is crucial. Rhythm control. Depending on the patient's stability, consider electrical cardioversion if the patient is symptomatic or if AF has been present for less than 48 hours. Clinical guidelines reference. The Heart Rhythm Society guidelines recommend a tailored approach based on symptoms, the duration of AF, and underlying cardiovascular risk factors. A 68-year-old male is admitted with fever, tachycardia, and hypotension. He has a history of chronic obstructive pulmonary disease (COPD) and diabetes mellitus. What is the immediate management protocol for suspected sepsis and what guidelines support this approach? Answer: the immediate management protocol for suspected sepsis includes early recognition, Use the SOFA score to assess organ dysfunction. Fluid resuscitation. Administer intravenous fluids e.g. crystalloids aggressively to restore hemodynamic stability. Broad-spectrum antibiotics. Initiate empiric antibiotic therapy within 1 hour of sepsis recognition based on local guidelines. Source control. Identify and manage the source of infection e.g. drainage of abscesses or removal of infected devices. Clinical guidelines reference. The Surviving Sepsis Campaign guidelines emphasize the Sepsis 6 protocol, which aims for timely recognition and intervention within the first hour of sepsis presentation. The 62-year-old woman presents with newly diagnosed hypertension. Her medical history includes chronic kidney disease, CKD, and heart failure. What antihypertensive agents are most appropriate for her condition, and what mechanisms do these agents utilize to manage her blood pressure while considering her comorbidities? Answer: in managing hypertension in a patient with CKD and heart failure, the following antihypertensive agents are appropriate. ACE inhibitors e.g. lisinopril. They reduce blood pressure by inhibiting the conversion of angiotensin I to angiotensin II, thus decreasing vascular resistance and promoting renal protective effects in CKD. Diuretics e.g. furosemide. These assist in managing fluid overload and heart failure, promoting sodium and water excretion, and providing symptomatic relief. Beta blockers e.g. carvedilol, beneficial in heart failure to reduce myocardial oxygen demand and improve overall heart function. Clinical guidelines reference. The American College of Cardiology (AC) and American Heart Association hypertension guidelines recommend individualized treatment plans, especially for patients with comorbid conditions such as CKD and heart failure. Discuss the principles of osteopathic medicine and their application in patient care. How do these principles differentiate osteopathic practice from allopathic medicine? Answer: the principles of osteopathic medicine encompass the following core concepts. The body as a unit. This principle asserts that the body functions as a whole. Each part affects the others, and health must consider the whole person. Structure and function are interrelated. The relationship between structure and function emphasizes that any change in structure may affect function and vice versa. For example, an injury to the musculoskeletal system may alter the nervous system's function. The body has self-regulatory mechanisms. Osteopathic physicians believe that the body possesses inherent mechanisms for self-healing and homeostasis. For instance, in the case of inflammation, the body increases blood flow to the affected area to promote healing. Rationale for treatment. Osteopathic treatment aims to restore balance and health by addressing dysfunction in the body. OMT techniques can be utilized to alleviate pain, improve mobility, and enhance the patient's overall well-being. These principles differentiate osteopathic medicine from allopathic medicine, which may focus more on treating specific symptoms rather than the underlying causes. Osteopathic physicians adopt a holistic and patient-centered approach that prioritizes preventative care and the interrelation of bodily systems, often leading to more comprehensive treatment plans. Explain the indications and contraindications for OMT. How can these considerations impact the decision-making process for a physician when developing a treatment plan? Answer: indications for OMT include somatic dysfunction, conditions such as back pain, tension headaches, and certain respiratory disorders, enhancing recovery, postoperative care to improve circulation and reduce pain, improving function. OMT can help patients with conditions like asthma or chronic obstructive pulmonary disease by enhancing thoracic mobility and diaphragmatic function. Contraindications for OMT include fractures or significant joint instability. OMT could exacerbate these conditions. Osteomyelitis, inflammation, or infection in the bones may worsen with manipulative treatment. Acute illness. Patients with severe infections or systemic illnesses may not tolerate manipulation. In decision-making, the physician must evaluate the risk-to-benefit ratio of employing OMT in the context of the patient's overall health status, preferences, and understanding of the potential risks involved. For instance, if a patient has a recent fracture, the physician must prioritize healing and might choose alternative treatment modalities rather than OMT. Discuss the significance of building rapport with patients in the context of osteopathic care. How does this rapport influence patient outcomes and the shared decision-making process? Answer: building rapport with patients is a fundamental aspect of osteopathic care. It fosters trust, enhances communication, and improves the overall patient experience. Rapport can influence patient outcomes in several ways. Increase compliance. Patients who feel understood and valued are more likely to adhere to treatment plans. For instance, an osteopathic physician who listens attentively and validates a patient's concerns will likely encourage the patient to follow through with lifestyle changes or medications. Enhanced information exchange. Strong rapport allows for open dialogue where patients feel comfortable discussing symptoms and concerns, leading to better diagnostic accuracy. Empowerment in decision-making. Involving patients in the decision-making process fosters a sense of control and ownership over their health. This empowerment can lead to more satisfactory treatment experiences and improved health outcomes. In the shared decision-making process, the physician should utilize open-ended questions and active listening techniques to fully understand the patient's values and preferences. Critically evaluate the role of the osteopathic physician in modern healthcare. How do osteopathic physicians address the challenges faced by the healthcare system today? Answer: osteopathic physicians play a crucial role in modern healthcare, particularly in addressing the challenges posed by chronic diseases, preventive care, and holistic treatment approaches. Their unique training emphasizes holistic patient care. DOS approach healthcare by considering the physical, emotional, and social factors affecting a patient's health. This can lead to more personalized care strategies that improve outcomes, especially for patients with chronic conditions. Preventive focus. With a strong emphasis on prevention, DOS often incorporate lifestyle counseling and education into their practice. They work to prevent disease through early detection and management of risk factors, which can alleviate the burden on the healthcare system. Access to care. Many DOS practice in underserved areas, helping to increase access to healthcare for populations that may lack medical services. Their training in primary care often prepares them for various roles in diverse communities. In the face of rising healthcare costs and a growing emphasis on value-based care, osteopathic physicians' comprehensive and patient-centered approach positions them as pivotal figures in advocating for healthier communities and effective healthcare delivery. Mr. Thompson, a 55-year-old male with a history of chronic lower back pain, presents to your clinic. He expresses frustration over his condition and is hesitant to pursue more invasive treatments. He has heard about osteopathic manipulative treatment (ONT), but is skeptical about its efficacy. How would you approach Mr. Thompson's concerns, and what steps would you take to integrate OMT into his treatment plan? Answer: to address Mr. Thompson's concerns, the approach should involve several key steps. Active listening. Begin by listening to Mr. Thompson's frustrations and understanding his experiences with his lower back pain. Validate his feelings and provide a supportive environment. Educate on OMT. Explain what OMT is, including its principles, techniques, and evidence supporting its efficacy. Discuss how it can alleviate pain, improve function, and serve as a non-invasive alternative to more aggressive treatments. Discuss risks and benefits. Provide a clear outline of the potential benefits of OMT for his specific condition, as well as any risks or contraindications. Ensure Mr. Thompson understands that OMT may enhance his quality of life without requiring invasive measures. Involve him in decision-making. Engage Mr. Thompson in a shared decision-making process. Ask about his treatment goals, preferences, and willingness to try OMT. Offer a trial session to see how he responds. Develop a comprehensive plan. If Mr. Thompson agrees to try OMT, create a comprehensive treatment plan that includes OMT sessions, physical therapy, and self-care strategies like exercise and proper ergonomics. Analyze the role of cultural competence in enhancing patient care within osteopathic medicine. What strategies can osteopathic physicians implement to improve their cultural competence? Answer: cultural competence is vital in osteopathic medicine as it promotes respectful and effective care that considers patients' diverse backgrounds. The significance of cultural competence includes improved patient satisfaction. Patients who perceive their cultural values and beliefs are respected tend to report higher satisfaction levels and compliance with treatment plans. Reduction in health disparities. Culturally competent care can help bridge gaps in healthcare access and outcomes among different populations, addressing disparities linked to race, ethnicity, and socioeconomic status. Enhanced communication. Understanding cultural differences in communication styles can improve interactions and reduce misunderstandings between patients and healthcare providers. Strategies to enhance cultural competence include training and education, ongoing training for healthcare providers on cultural awareness, sensitivity, and the impact of social determinants of health, diverse staff representation. Hiring diverse healthcare professionals can help create a more inclusive environment and enhance communication with various patient populations. Patient-centered care. Incorporating patients' cultural beliefs into care plans, fostering a collaborative relationship where patients feel empowered to share their preferences and values. By implementing these strategies, Osteopathic physicians can provide more effective, equitable, and personalized care, ultimately leading to better health outcomes. Explain the various techniques used in OMT and their specific indications. What clinical situations may necessitate the use of specific techniques? Answer: Osteopathic manipulative treatment (OMT) involves several techniques, each with distinct indications. Myofascial release. This technique involves applying gentle pressure to myofascial tissues to release tension. It is indicated for muscle tightness, postural imbalances, and conditions like fibromyalgia. Soft tissue technique. This method uses stretching, kneading, and pressure to relax muscles and improve circulation. It is beneficial for muscle spasms, tension, headaches, and other somatic dysfunctions. High velocity, low amplitude (HVA) technique. This involves a rapid thrust to restore proper motion in a joint. It is indicated for restricted joints, such as in cases of acute lumbar strain or thoracic outlet syndrome. Counter strain, a passive technique that involves positioning the patient in a position of comfort to relieve muscle tension. It is useful for treating acute pain conditions, such as sprains or muscle strains. Cranial osteopathy. This technique focuses on the cranium and its influence on the central nervous system, indicated for headaches, migraines, and some neurodevelopmental disorders. The choice of technique depends on the clinical situation, patient preferences, and the physician's assessment of the patient's somatic dysfunction. It is crucial to tailor OMT to the individual needs of each patient, considering factors like their overall health, pain levels, and specific conditions. Describe effective communication strategies that osteopathic physicians can utilize to improve patient outcomes. How do these strategies relate to patient engagement and adherence to treatment plans? Answer: effective communication is a cornerstone of successful patient care and can significantly enhance outcomes. Key strategies include active listening. This involves fully concentrating on what the patient is saying, demonstrating empathy, and reflecting on their concerns. By validating the patient's feelings, physicians can foster a trusting relationship. Open-ended questions. Using open-ended questions encourages patients to share more about their experiences and concerns. This approach helps to gather comprehensive information and promotes patient engagement, empathy, and rapport building. Physicians should express genuine concern for the patient's well-being. By acknowledging emotions and building rapport, they can strengthen the therapeutic alliance, enhancing treatment adherence. Clear and accessible language. Avoiding medical jargon and using plain language can help ensure patients understand their diagnosis, treatment options, and the rationale behind their care plan, involving patients in decision-making. Engaging patients in their care decisions encourages ownership and commitment to their treatment plan, resulting in improved adherence and satisfaction. These strategies foster patient engagement by creating an environment where patients feel valued and understood. When patients are engaged in their care, they are more likely to adhere to treatment recommendations, leading to better health outcomes. Discuss how OMT can be integrated into a comprehensive patient management plan. What factors should be considered when deciding on the integration of OMT with conventional treatments? Answer: integrating OMT into a comprehensive patient management plan involves several considerations. Patient's medical history. Evaluate the patient's medical history, including any contraindications to OMT and the presence of comorbidities. Understanding the patient's overall health profile is crucial for safe integration. Treatment goals. Define clear treatment objectives. If the aim is to reduce pain, enhance mobility, or improve quality of life, OMT can be tailored to meet these goals effectively. Conventional treatments. Consider how OMT can complement conventional treatments, such as physical therapy, medications, or surgical interventions. For instance, OMT may be used alongside physical therapy to enhance outcomes in patients with musculoskeletal conditions. Patient preferences. Engage the patient in discussions about their treatment preferences. Some patients may prefer non-invasive options like OMT, while others may opt for medication or surgery. Evidence-based guidelines. Adhere to evidence-based guidelines regarding OMT's effectiveness for specific conditions. This ensures that the integration of OMT aligns with best practices in patient care. By carefully considering these factors, osteopathic physicians can create a personalized management plan that maximizes the benefits of both OMT and conventional treatments, ultimately enhancing patient care and outcomes. Analyze the ethical considerations involved in osteopathic practice. How can osteopathic physicians navigate ethical dilemmas related to patient care? Answer: ethical considerations in osteopathic practice encompass several key principles. Autonomy. Respecting a patient's right to make informed decisions about their care is fundamental. Osteopathic physicians must provide all necessary information regarding treatment options, including risks and benefits, to empower patients. Beneficence and non-maleficence. Physicians must strive to act in the best interest of the patient, beneficence, while avoiding harm, non-maleficence. This requires careful consideration of treatment modalities and the potential risks associated with OMT and other interventions. Justice. This principle emphasizes fairness in the distribution of healthcare resources. Osteopathic physicians should advocate for equitable access to care for all patients, regardless of socioeconomic status or background. Confidentiality. Maintaining patient confidentiality is essential for fostering trust. Physicians must ensure that patient information is kept secure and shared only with necessary parties involved in the patient's care. In navigating ethical dilemmas, osteopathic physicians can adopt the following strategies. Consultation and collaboration. Engaging with colleagues or ethics committees can provide valuable insights and guidance in complex situations. Reflective practice. Physicians should reflect on their values and the implications of their decisions, ensuring alignment with ethical principles and professional standards. Patient engagement. Involving patients in discussions about their care and ethical concerns fosters transparency and supports shared decision-making. By prioritizing these ethical considerations, osteopathic physicians can enhance patient trust, uphold professional integrity, and promote high-quality care within the osteopathic practice.